Dr. Gioia has been with us about 10 years at the Children's National Medical Center, and he's the head of the neuropsychology program. Dr. Gioia's work has been to try to focus on that issue of mild traumatic brain injury, trying to determine what is a significant brain injury, what kind of injury requires you to stop your activity and for how long, when is it okay to go back to the activity, and what can we do to prevent them in the future.
Our 3 kids in the last 3 years have suffered a combined 7 concussions in all. It started just 3 years ago when our oldest daughter, Samantha, got a concussion playing travel lacrosse. When she got home that night, she was nauseous, she had light and noise sensitivity, she had just vice-like headaches. By the next week, she was really hurting. She was so sick that I called around and some friends suggested that we have her see Dr. Gioia.
What we know is that the vast majority of injuries to the brain are the milder types, probably up to 90%. The brain can be impaired even when you've not lost consciousness. You are setting up a very dangerous and vulnerable situation in the brain when it has taken enough force to change the way that that brain and that software in that brain works.
In my experience, coaches and school administrators just don't have enough information about concussions. They didn't realize that cognitive exertion can exacerbate a concussion or make the recovery that much harder. There's room to educate schools in that regard.
Well, we've got to get the word out, and we've got to get folks to really pay attention to the gravity of the issue and to recognize that on the one hand, concussions or mild traumatic brain injury is an injury that most kids will recover from. But what we also know is that some kids will not recover as quickly, and some kids, again, if they're hit twice while that first injury is not yet recovered, can have devastating outcomes. And we have no way of predicting who that is. And so it has to be taken seriously with everyone.
Kids my age, especially my guy friends, when they heard that I was out for a month of school and then 2 to 3 months for sports, they just thought it was absolutely ridiculous. You know, they say, we get them all the time, it's no big deal, but what they don't realize is the long-term effects it could be having on them.
Dr. Gioia, before he even had the computerized toys that he has now that's worked with the athletic trainers, the coaches in the area, to give them an understanding of what these injuries might mean to these children, raised awareness. That groundwork allowed him then, when he had the new tools, to easily go back to the coaches, to the athletic organizations and say, let us help your children.
Drew, what I want to find out from you is what happened, how it happened, how you've been feeling since you had your concussion.
After concussion number 5, I was in tears in his office, asking him, what have I done wrong? You know, is there something genetically wrong with us? What's going on here? And he, in his wonderfully hopeful voice, said, not to worry, Suzanne. It's not you. It's the fact that this generation of kids is spending more and more time on the playing fields in contact sports. So the odds are that we're going to see more concussions.
So what we're going to do here is we got this test that's going to help us understand how your brain's doing at this point, kind of after that injury. And so we want to see how fast you can think. We want to see how well you can remember things.
Dr. Gioia never told my kids they could never play again. But what he's allowed them is to make wise choices for themselves.
Dr. Gioia helped me by just treating all the symptoms and telling me what to do, giving me good advice.
Many times I'm asked, would you have your son play football? You know, do you think kids ought to be playing soccer and lacrosse? And my unconditional response is absolutely. But I would want to know that the sporting system is aware of the risks of various injuries and that they're taking the proper precautions in the event that the youngster is hurt. Now we're going to put the arms out, we're going to spread your fingers, and now close your eyes.
Well, I love Dr. Gioia. I think he's very personable. You know, he just made you feel comfortable right when you walked in the office. You know, he has you laughing. You know, the sensitivity to light was terrible, and you know, he shut the lights off, and he could barely see his own work. So he's just very caring.
For Dr. Gioia, the practice of medicine isn't just a practice. Medicine is a mission. If he were just a practitioner, he'd close the door at 5 o'clock and be done. But this is a doctor who spends his spare time educating neighborhood groups, talking with groups of coaches.
Also, Dr. Gioia is a tireless advocate for this whole issue of traumatic brain injury. He's been on Capitol Hill, he's talked to Congress. He really has a passion about that.
He spent a lot of time lobbying in our state legislature to get better laws to protect kids. And he's even traveling the world and acting as a consultant to doctors internationally. That's not practicing medicine. That's a man on a mission.
In my work with actually the Washington Capitals professional hockey team, I tell the story where if a player goes down tonight, I'll get a call tonight from the head athletic trainer. That player will be in my office tomorrow and we'll evaluate them. And we will start the treatment right away. That needs to happen for every child that has an injury. It needs to be identified that day. The systems need to be put in place that next day where we can begin to understand their injury and treat them and bring them back to recovery. To me, there should be no difference between whether you're a $1 million athlete or you're a 15-cent third grader. Brains are as important at each level.